Well, good evening, everyone. Welcome to our new workshop series here at MAPT. Excited to be with you tonight. It's me all alone, looking at all of the comments and everything from everyone. And hello, everybody. Say hi and tell me your name. And well, I see your names on the feed, but tell me where you're at, and that would be exciting to see. I think we've got quite a few people in the room, and looking at to gain some experience and some information about MMIs and how to approach ethical questions and ethical dilemmas in the MMI. And so I think it'll be a fun night. We're going to do this for a few weeks. So every Thursday night we'll be together, and we'll be doing this. And we've got people from all over the place: Georgia, Kansas, the Bay Area. Hello, Tyra, California, Rochester, New York, DC, Vancouver, Canada, Connecticut. We've got San Diego, California. This is exciting to see people from all around the country. Here in Texas, McAllen, down South Texas. Hello, Daniela. Great to see everybody here. Bethlehem, Pennsylvania, Michigan. Really exciting. Colorado. I hope you're having a good day today. It's been a glorious day here in Austin, Texas. And so I'm excited to be presenting to you guys tonight just a little bit about the MMI. We'll talk a little bit about ethics. We'll do some introductory information this evening, and then we'll launch into a scenario that we'll look at and kind of evaluate. And I want you guys to be ready to give us your input into how you feel about the scenario that I'm going to present. And then each week we'll do a different scenario. We'll talk a little bit about the situation, and we'll explore it a little bit. So it's exciting to see all of you here, and I'm anxious to get to talk to you. So what we're going to do, and I want to give you some information as we go along about the structure of MMI and kind of what it's all about, because a lot of schools are using MMI as a way of interviewing to get more information about you as applicants. And so we want to explore that a little bit and understand it a little better so that you can do really well in your interview setting when that happens. And notice I said when that happens and not if that happens, because I want you to be sure of yourself. I want you to be confident going into the application process, and be able to do well in the experience, whatever the experience is, but certainly in an MMI type of experience. So we want to evaluate that and see how it goes. So I have some slides to present to you tonight, and we'll look at these, and then we'll end up on a scenario, and we'll look at that a little bit and see what you think. So the MMI, I want you to ace your MMI. And so the first question is, and many of you already know this, what is MMI? And MMI stands for the multiple mini interview. Now, this is in contrast to the traditional way of interviewing, which is, traditionally two one-on-one interviews with typically faculty members. Could be a student or a resident, medical student or a resident. Could also be a community physician that works with the medical school. But in an MMI, it's going to be a much different scenario, much different sort of a thing. And so what we have in a multiple mini interview, this was, and what I'll give kudos to the I'll give kudos to the Canadians among us tonight, that the MMI, the multiple mini interview, was developed in Canada, and it was brought to the United States. And so we're thankful to the Canadians among us tonight. Thank you. But the multiple mini interview is really a short, a grouping of short interview stations, somewhere between 6 and 10 typically, where you are given some sort of scenario where you're going to be presented with, and you're given a finite amount of time to evaluate the scenario and to kind of think through it, usually around 2 minutes. Then you go into the room. In this case, in our current pandemic world, it would be a virtual room that you're entering. But in the old-fashioned sense of things, you'd be entering into a real room where there would be someone sitting there and ready to assess, to hear what you're going to say, and to assess your what you're saying to them. It's really meant to assess some really important personal qualities and skills that you have, and those being skills of communication. Can you establish rapport? Can you communicate with me in an oral fashion that is appropriate, that is compelling, that is able, and things like that. They're also looking for in these type of stations where you have about 8 minutes typically to go through your response to the scenario. They're going to be looking at your critical thinking skills. Are you able to take on the scenario that's presented to you and think about them critically? They're looking at self-awareness. Are you aware of your position in this world, culturally, for example, socially, for example, your own paradigms, and how those might relate to the scenario or other people's paradigms. Situational aptitude. They're really looking for your thought process. What are you going through in this scenario to make a decision about what should or should not be done, what you should talk about, etc. So that's basically what an MMI is all about. Now, there are really 3 types of MMI stations. There is an ethical scenario station, or multiple stations with ethical scenarios, and we're going to be looking clearly at that in this series of workshops. There are character development questions that are going to ask you to talk about particular things relative to your own character and how those are expressed. And we'll talk a little bit, about those. A good example of those would be something like, what is your greatest weakness, or potentially what is your greatest strength? Tell me about a time when you made a mistake and kind of what happened in that particular at that particular time. Describe a time when you needed to ask for help in something. What are personal challenges? What personal challenges do you think you'll face in medical school or as a physician? These are some examples of character development type of questions. And then there are teamwork problems where potentially you might be in a setting of a variety of students, perhaps a small group of students, and you'll have to use your understanding of your own personal position on a particular situation, and use that in conjunction with other students that are being involved. And so these can be worked out and expressed in a variety of ways. So, for example, in some MMI situations, you'll be asked to act a certain role. Perhaps the person there evaluating you has been taught to act in a certain way. Maybe they've been taught to be aggressive. Maybe they've been taught to be very submissive. For example, and you will be acting out a role as a physician, or as some other type of healthcare worker, or as something else, as a friend or a family member in a particular situation. There are non-acting ones non-acting scenarios as well. And then, as I mentioned, there's the teamwork situation where you're asked to give directions to see if you can help your partner do an exercise, for example, or something to that effect. So there are a variety of ways that MMI stations can be oriented. As I said, usually 2 minutes to evaluate the scenario, about 8 minutes to actually participate in the activity with the evaluator, and often 6, 7, 8, maybe as many as 10 stations that you would go through in these types of scenarios. I'd like to talk about that there's a step-by-step process that we would use in order to answer these types of questions. What you would be asked to do, and what I suggest that you do, is identify what are the key parts of this scenario. Piece it out. The scenario is going to be a short synopsis of a particular situation that is being given to you, and what you would need to do is to identify what are the key parts of this scenario. What's going on here? Define then what is the problem presented in this scenario. There may be multiple problems. There may be only one problem. What is the problem that is being presented in this scenario? And then collect information that may be relevant to answering this situation. Make a decision then about what you want to do, and then answer the question. So you're going to be doing this in the course of a couple of minutes, and so that's why it's a short a short scenario that's being presented. It's not going to be something that's long and drawn out. It's not going to give you a great deal of information. You're going to be asked to evaluate the particular scenario, and then you're going to respond to it. It does not necessarily require a great deal of background knowledge. Not a great deal of background knowledge. This is not a content test for you. This is not a testing your ability, your knowledge of philosophy or as a part of philosophy of ethics, or how to. You're not going to be asked to generate a list of exact things that would be used to answer the question. It is really all about you evaluating what you would do in a particular situation. In ethics scenario stations, typically they're kind of stressful because they bring up often situations that are complicated or that are controversial. So you would want to evaluate them and know that they're going to be stressful for you. Often, as I say, the most stressful type of a station. It really kind of does put you on the spot to make a stand, either one way or another, and to reason out why you would do or say that particular thing to the interviewer, to the person there representing the institution, whether they're an actor, whether they're a faculty member or otherwise. It's really designed to put you under a little bit of pressure to see how you can handle pressure in particular situations. And it does involve often morally challenging situations. Sometimes they will involve ones that we're familiar with. For example, maybe euthanasia, abortion might be one that could come up, although I think often institutions will avoid the obvious ones and go with some that are maybe not quite as obvious. It usually involves some sort of morally challenging situation, challenging perhaps the way you think about the world, the way you think about other people, or potentially the way you think about the paradigm in which you're approaching the world. The ethics stations, what they are not there to do is to really evaluate, do you have an ethical compass, and where does that ethical compass point? Does it point true north or not? This is not the purpose of this situation. It's really to see, how do you process information? How do you process a particular given scenario? And then how would you come to a conclusion about what you would do in the particular situation? So I'd encourage you to sort of think about it in that way, that there are a variety of things going on here in these ethical stations that you'll need to sort of get a handle on. But I don't suggest at all that you're going to need to do a whole lot of study in philosophy about what ethics is all about as a branch of philosophy. That's not the point of these types of stations. So let's talk a little bit about ethics. Ethics is all about, how do you determine conduct? How do you determine how you're going to behave within the context of a particular situation, a particular scenario? And what we have to recognize is that when we talk about behavior, when we talk about conduct, we're really talking about the differences between these three things: morals, which is your personal beliefs and practices, often rooted in some type of religious practice or spiritual sense of yourself, as opposed to ethics, which is really an organized set of rules, rules that dictate conduct, that dictate behavior, and these would be professional codes, such as in medicine, law, as well as some of the other traditional professions, often have these organized set of rules that give you a code to follow in terms of your behavior. And then clearly there are legal obligations that we all have as members of society. And so we have these three sort of points: morals, my own sort of set of beliefs and how I want to practice life; ethics, the rules of my profession, in this case in medicine, the rules of the profession, as well as laws that really can constrain all of us to certain behaviors. So we have to really recognize that acting according to my own morals really may not meet an ethical or a legal standard. And so I must recognize as an individual that that's going to be potentially important in terms of how I'm going to pursue a particular behavior in a particular situation. So I want you to keep in mind those types of things when we're talking about these scenarios that we're going to be presenting. And all of the scenarios that I will be presenting over the next few weeks are real scenarios. These are real world scenarios. These are not made up. They are real. And I think they're interesting, and they will help us sort of evaluate kind of how we might behave in a particular situation. So what I would suggest is, in this ethical decision-making framework that we're talking about here, what are you going to do? What is the process that you're going to go through? So my suggestion is, when you get to an MMI station that is where an ethical dilemma is being presented, what the first thing you want to do is look at the scenario and identify what actually is the problem. What is the issue being presented? There is typically a dilemma being presented here, and they're asking you to evaluate it and to understand it, and then to make a decision about what you would do in that dilemma based on your morals, perhaps based on your own ethical position or the position of the medical community. You want to understand within the context of the scenario that is presented to you, what are the things that you know? What are the facts? And what are the things that you don't know? What are the unknowns here? And this is going to be always true in the scenarios that are presented in these types of stations, as it is true in the real world. You have to understand, even in the real world, what are the things that I know and what are the things that I don't know. Then you delineate what are the options available to me to resolve this dilemma. What are the ways that I can go about resolving what's being presented in this scenario? And then I'm going to answer the question. I'm going to implement, in other words, I'm going to implement the optimal decision based on how I'm viewing it in the context of a variety of things. And what I would say is that there are indeed a variety of things that you might have to look at and consider when you're looking at these types of ethical scenarios. And here's just a few of what those might look like. There are clearly going to be medical issues. In other words, what's going on here medically? Now, at this point in your journey into medicine, you're not going to know a lot about, and they're not going to expect you to know a lot about the medical issue involved. They'll give you the information typically that you need to know. There may be legal issues. There may be cultural issues involved in the scenario. There may be institutional, social, or even financial issues that you'll have to think about. And one of the things that I think is valuable in stations like this is to allow the interviewer to see that you recognize that there are multifaceted issues related to the scenario, that it's not cut and dry, that it's not straightforward, that there are a lot of factors involved in determining behavior in the particular scenario. So I want you to really keep in mind that evaluating what you're going to do, you have to evaluate what are the multifaceted issues going on here. What are the multifaceted parts of this puzzle that you're being asked to put together? And I think that will be very helpful if you think about it in those terms. Not that you need to know the medical issues involved and the ins and outs of whatever particular medical situation is being presented to you. Not that you need to know the applicable laws, whether they're state laws or federal laws or potentially even local provisions. But recognizing that there are legal standards that you are being asked to meet as a citizen and certainly as a physician. Obviously, there are cultural issues involved. We live in a multicultural society, and different cultures approach different issues very differently. Often. And so institutionally, the hospital you're working at or the medical school where you are a student may have particular rules or policies that may be applicable in a particular situation. There are often social elements to a particular scenario, such as the differences between how someone that is wealthy might approach a particular problem or dilemma, as opposed to someone who is socioeconomically disadvantaged. And there are financial issues that often are involved. So I think recognizing that and making sure that you communicate, that you recognize that there are these multifaceted elements of any case, and that those all have to be examined when you're making an ethical decision. So let's look at a scenario. let's look at one. I'm gonna read this to you. We're gonna think about it, and what I want you to be able to do is type into the chat and into the comments, and let's talk about what this might look like. So here's the ethical scenario for tonight. Mr. Smith is an 85-year-old man who is in a nursing home. He's a nursing home resident, and he's been admitted to the hospital, to your service, from the emergency department with pneumonia. This guy, Mr. Smith, has been in the nursing home for 6 years and has a very severe dementia of an Alzheimer's type. According to the nursing records from the nursing home, he has no legal next of kin or contact person listed in his paperwork. There's no advance directive, such as a living will or healthcare power of attorney on file. And his nurse at the nursing home notes also in his paperwork that he is non-communicative. He does not communicate at all. And his baseline, he has contractures in all of his extremities. In other words, his arms and legs are contracted, which is a serious, very, very obvious signs of difficulties and of very common. So the question here, the ethical scenario presented here is, do you treat his pneumonia? Do you treat his pneumonia? And so I want you to think about that for just a second. Think about this scenario. You have this elderly gentleman who has no one, who is in a nursing home, who comes in, is presented to you as a physician with pneumonia. He's clearly got some very serious problems in terms of his cognitive capabilities, as well as other physical qualities about him. There's no one else there to make decisions for him. And you are presented with the question, do I treat his pneumonia or not? So I'm interested to know what some of you are thinking about this scenario. So I'm going to read some of them off and let you know, and we'll kind of see what this looks like. So I'll put some of them up here. So we have one here says, yes, I would treat his pneumonia because as a doctor, I help any sick patient unless I have legal obligation not to do so. Okay. There's one. We have a couple of other yeses. We have, let's see. Now, everybody needs to chime in. That's the point of this. So here's the easy answer. I like this one. An ethical board is needed for further decisions. So let's just punt it. In other words, let's punt to somebody else. Don't mean to put you on the spot, Leah, but that I like that one. There's a variety of others. Yes, I would treat his pneumonia because aside from the fact that he has dementia, the patient with no family as a physician, I would treat him regardless of his condition. Somebody else said I would treat his pneumonia and continue trying to contact any family members of next of kin. The name, incidentally, the name of this scenario is nothing relative. Nothing relative. In other words, what you're being presented with here is there is no one. There's no one there to make decisions for this gentleman. He has no relatives. He has no next of kin listed, etc. Here's another one that says, first, maybe try to establish communication with him, and the ethics board of the hospital then treat accordingly. I like that. I mean, that's the easy out, right? Is to say, well, we need to take it to the ethics board, and yes, hospitals have ethics boards, but within the context, as you understand here, within the context of an MMI situation, of a multiple mini interview, you can't just say, what does the law say? I'm going to do whatever the law tells me to do. You must recognize you're being asked to sort of think through this critically and evaluate it and make a presentation on over the course of 6 to 8 minutes of what you would do and why. What are the issues involved within the context of your mind, and how you might want to approach those. Treat the pneumonia, says another student, because he came into the emergency department for pneumonia. Then refer his other conditions to his primary care physician. Sounds that I can't remember who said that one. Without having any documentation or next of kin to say otherwise, you must treat the illness accordingly, despite the fact that his quality of life will not improve without the pneumonia. Another student says, I hear both sides of the dilemma. On the one hand, you don't want to treat a patient without consent. On the other hand, a patient's life is at risk. I would treat him because his life is at stake. There's an interesting one. It looks like most of you, as I'm looking here, are saying, yes, I would treat the pneumonia. Ashley says, yes. No, Ashley says, yeah, you do treat him if he can't you can't legally deny assistance, and he has no point of contact, so you should treat him on the grounds that he can't legally decide for himself. Is anybody going to say no? I want to hear somebody that says, no, I would not treat him. So anybody out there that would say, no, I'm not going to treat the pneumonia. I'm going to not treat the pneumonia. Anybody? Yeah, Peter says, what's the argument for not treating him? Joe says insurance reimbursement is a big factor. Yeah, but and as I said before, finances is one of these. Who's paying the bill for this? I mean, we don't want to boil it all down to who's paying the bill, but there are going to be costs here involved. And who's paying that bill? Good question. So we finally have one who says, I would not treat the pneumonia. And I'd kind of like to hear more from, let's see who that was. Maybe a little bit more from, I guess it's Nisreen. Nisreen, if you'd like to talk a little bit more about that. But let me just offer a few things that I think might be helpful. I'm going to put the scenario back up for students who are maybe just joining us. But what might be some arguments for yes, I would treat the pneumonia? So, for example, the question might be asked, well, what are the physician's duties? The answer, of course, is the duty of a physician is to treat patients. So physicians, in that case, the physicians should always err on the side of life, always err on the side of treating the illness, treating the patient there. Moreover, we could say if an exception is made in this case, then where does that end? Patients might see other patients in similar powerless situations, might not be able to trust this particular doctor or other doctors if the doctor doesn't treat the pneumonia. In other words, a good argument for yes, I would treat the pneumonia is that ultimately the doctor has some sort of fiduciary responsibility to treat the pneumonia for the patient that comes to the hospital. Some arguments for a no answer might be there could be a variety of them. And they often center in this particular scenario. They often center around the quality of life of this individual, of this man. He obviously cannot participate in any kind of meaningful communication or conversation. In his present circumstances, he's at best only gives meaning to those around him, those that are taking care of him, and he's not gaining anything out of it meaningful from this human contact, from the interaction. In addition, talking about finances, he's potentially a drain on resources. We don't know a lot. This is be an example of we don't know what his financial situation is. If he's in a nursing home, doesn't have any family, he may be destitute. He may be wealthy. We don't know the answer to that question. This is an example, as I was saying earlier, of identifying what do we know, what are the facts that are being presented here, and what do we not know? What do we not know about this situation that would lead us to make a decision? What we are so then the other question here is, what are we as physicians to treat? Do we treat a patient or do we treat a disease? If we treat patients, let's say, and not diseases, then maybe we should not treat his pneumonia. What is potentially the benefit here to this 85-year-old man of treating the pneumonia? Would it be better within the context of the no response to not treat his pneumonia? So there are a variety of sort of ways, that we could go with this, and I'm seeing a lot of responses here. We have one response here that says, "No, I don't think it's worth it for him to suffer from the treatment because his quality of life is so bad." And so as you can see, there are sort of a variety of kind of ways that we might want to look at a situation like this. And honestly, what the interviewer is not looking for is for you to know the answer. There may not be the answer here. They may not have they are not presenting to you a scenario like this in order for you to come up with the right answer. They're looking at what are your thought processes. And remember what we had talked about earlier in terms of the various things to look at. I want you to think about, what are the medical issues here? What are potentially the legal issues here? You're not going to know these necessarily, but I think what you're going to illustrate to the interviewer is that you recognize that there are multiple facets to this particular scenario, and that a lot of different things have to be considered in order to come up with a conclusion. So, the question then becomes, let me ask you that, how far, most of you are saying yes, I would treat him. So what if the patient needs intubation? What if he needs a breathing tube? What if he needs ventilation? What if he needs antibiotics, which you would assume he would for pneumonia? How far would you go to treat his pneumonia? How far do you go to treat this 85-year-old man's pneumonia? To what extent will you go to make that to make that happen. Joe says, personally, I would treat, but I'm trying to play devil's advocate. Maybe he's arguing that some providers would say, Joe says, some providers could say, do the minimum and let the disease take its course. Thereby, I guess, Joe providing kind of an alternate viewpoint to that. Until he's stable, says Stella, and ready to go back to the nursing home. Let me add this to it. Think about this. Again, here's the scenario. Think about this. One, we could argue that given the fact that Alzheimer's patients, that Alzheimer's as a disease is not what kills the patient. The patient typically does not die from brain dysfunction of some sort, but from something else, some other pneumonia, some other type of infection, and that this particular patient's pneumonia is likely part of the final stages of his disease of Alzheimer's. So it's not terrible of an act to not treat what is roughly equivalent to a terminal condition. So it brings up the question, really, what do physicians treat? Do physicians treat patients, or do physicians treat diseases? What do you think about that question? Do physicians treat patients, or do physicians treat diseases? Patients with diseases. Now, I'll tell you this now, as we kind of bring this into some sort of conclusion, that this particular scenario, I was familiar with the resident. It was a resident who was dealt with this particular patient in the real life part of what happened here. This was a young resident who was dealing with this, and he chose, within the context of everything he had available to him, looking at the scenario, looking at the picture of what had happened with this particular patient, the entirety of the picture. This particular patient was made comfortable in the hospital, and the pneumonia was not treated. The patient was made comfortable and eventually did pass away. So so what we have here then is the conclusion of that particular resident, a senior resident in internal medicine, and what his particular position was, the ethical position that he took was that I'm here to treat the patient, not in this case the disease. And that was the recognition of this particular physician, this senior resident, that it was a pneumonia that was going to ultimately cause the death of this patient. Almost certainly, if he had treated this pneumonia, gotten the patient stable again, sent the patient back to the nursing home, it would have been only a matter of time before the patient was back in the hospital, possibly with another pneumonia or some other infection of a dire condition or other dire condition. The hospital in the case supported the actions, as did the attending physician, supported the actions of the resident in this particular case. And the position of the resident I think, was to treat the patient, as a human being, to treat the patient, to make the patient comfortable, and to then allow the patient to succumb to the disease that was taking him anyway. Frista says they act in the best interest of the patient, so they treat the patient. How you treat the patient in this particular case would be up for debate in terms of ethically what was there to be done. Now, what I want you to do again, what I want you to be able to see is that we have various things going on here. There's a medical issue, clearly the pneumonia, but also Alzheimer's disease. The quality of life here is an issue. There could be cultural and or religious issues. Someone brought up, if this patient was a particular religion, then it may not have been appropriate to treat the disease as it may have needed to have been treated. Clearly, there are going to be legal confines for a doctor in this particular situation with no legal next of kin. What you can't typically do is go to a, somebody mentioned in the comments, you might have to take this to a judge, but within the time limitations, that may not be possible. Does the hospital have institutional policy about how these types of things should be pursued? What are the financial constraints related here? Part of what we don't know. And again, what you're doing in the MMI here is you're making a decision, you're defending it based on your concept of these types and perhaps others of issues related to the case, related to a case. But you're going to take a position. You're going to take a position and say, which most of you have, is to treat the pneumonia. So I hope that you see that it's not about a right or wrong answer here. It's about you thinking through the scenario, thinking through what are the issues involved here, and then planning out and making a case for a position based on your recognition that there are a variety of things going on that may be applicable within the context of this particular situation. So this is what we're going to do. Now, again, if you were coming in here tonight expecting that I was going to give you a scenario that I was going to say, oh, yes, you do it, or no, you don't do it, that's not how it's going to work. I'm going to present you with difficult situations, difficult scenarios, and we're going to talk about it a little bit. I wish there was a way that you could actually talk in here to the broadcast. Maybe we'll figure that out at some point, but I'm glad that you're typing in your responses. That's fantastic. We've got so many students from all around the country and literally all around the world that are listening in, and I think that this is really fantastic that you've come into this. But I want you to recognize, and again, what I want you to see is that in the MMI type of interview situation, what you're not being asked to do is evaluate what are necessarily the medical conditions, what medical realities, what necessarily are the laws applicable to this type of situation, but a recognition of here are the various points that we need to consider. Having considered all of these points, this is what I'm going to do in this particular situation, in this particular scenario, based on my understanding of what the realities are. I recognize that there are things that I don't know, that there are things that I do know, and that I move forward. All right. Well, I want to thank you for being here tonight. I'm looking forward to this. This is really great. If I can raise questions in your mind based on this type of scenario, that'd be great. I know that what you're looking for is answers. I'm really much more interested in raising questions than in providing answers. But when, no, seriously though, I hope you get the context that we're talking about an MMI. I want you to do well in MMI situations, and I want you to see the variety of variety of things that arise in these situations, in these scenarios that can be helpful in answering a question like this. So I want you to know how much I appreciate all of you. What this is all about is helping you to be successful in your goal of going to medical school, becoming a physician who treats patients, and enjoying that and being effective within that context. So I want to remind everybody. Many of you are MAPT members. Some of you are not. That MAPT is there to serve you. That we have a software product, an online software product that's there to make it easier for you to traverse this difficult and complicated process that we call the pre-med journey. And we want you to be successful in that. And we want you to feel like you know what's going on and how to go about doing it. And so what I'd suggest that you do is try out MAPT, mapt.com. You can get a 14-day free trial. Check it out, see what you think. You don't have to have a credit card or anything for the 14-day trial. And then if you like it, then you can actually participate in it. I'm a real advocate for MAPT and for the software product. I think it's got a lot of benefits for you to help you in this journey. MAPT also has one-on-one advising available to you. We do a lot of one-on-one advising with students. General pre-med advising, we deal with freshmen up to non-traditional students, a lot of non-trads that we work with. We can help you through the entire cycle. We can help you through only parts of it. We can answer your questions. Certainly, we can give you feedback on your personal statement, on other essays that you're going to be doing. So I'd like for you to think about that. So here you see an example of the MAPT platform. This is the AMCAS GPA calculation. Shows you the very nice graph there of your GPA and the successes and the difficulties. In this case, there's a nice little upward trend in the semester by semester GPA. We do one-on-one advising, and we want you to see that that's effective and is there for you to participate in. So we're going to be doing this every week for the next few weeks. I'm happy that you're involved in this and that you're interested in it. It's an awesome process, and I want you to be here next Thursday night, 6 p.m. Central. Next Thursday night, we'll do another ethical dilemma. We'll look at it. Hopefully, you'll be here to evaluate it with me and to spend a nice time on Thursday night with me. And I love it to be able to see all you wonderful people out there who are striving toward a wonderful career that we all need. So have a good night, everybody. Enjoy your evening. If you're studying tonight, good luck to you. If you're chilling out tonight, great. You need that sometime. But nonetheless, enjoy your evening. Have a great night, and we'll see you next week. Bye.